Outside Colorado's hospitals, the world looks like it's back to normal, with no statewide mask mandate or capacity restrictions. Healthcare workers, though, are seeing a crisis that feels very familiar.
There literally just aren't enough people available to take care of the number of patients.
Dr. Camilla Sasson works in an emergency department in Denver. Right now, she wants everyone to pay attention to the strain on our healthcare system.
If you get into a car accident, if you have a heart attack, if your sugars are really high and you have a diabetic emergency, all of those things mean that you may have a different level of care had you not come in today versus maybe 6 months ago.
Resources are scarce. It's why the state on Tuesday reactivated crisis standards of care for staffing. This gives hospitals the flexibility to move staff, and it offers guidelines for how and when family members can step in to help with feeding and bathing to free up workers. It even provides legal protection if care isn't what usually would be standard.
The current crisis standards of care authorization allows is things like abnormal staffing levels, where you don't have as many people to take care of you as you might normally.
Dr. Matt Winia helped craft Colorado's crisis standards of care during the pandemic. These guidelines for staffing were deactivated in February. Now, nearly 40% of facilities expect staffing shortages within the next week.
We're doing it because we have to. We have no choice. And the fundamental ethical principle here is that you are trying to save as many lives as you can with the limited resources that you've got.
And when people say, like, this doesn't matter, it's not going to impact me, I don't have COVID, I've got a vaccine, whatever it is, it impacts all of us.
Right now, there's no statewide pause on elective procedures, but the state says hospitals can choose to pause these procedures to reassign staff. Kyle.
Them a lot of leeway, Kelly, to do whatever they need to do to maximize staff. So whether it's holding off on lab work or radiology or anything else that they deem non-essential, so they can move bodies over to care for COVID patients and other emergencies.
Yeah, hospitals are at a breaking point, and they really haven't been catching any break. Doctors today were telling me that nurses, healthcare workers will have to take on more patients to maximize those resources, and that may mean that a nurse may take a little bit longer to get to you if you're in the emergency room. But of course, hospitals are saying if you have an emergency, please go to a hospital.
Certainly. And the idea of like National Guard checking people in, I think, is going to be a shock to the system as well. All right, Kelly Rinke, thank you.